In all honesty, it was a bit of an odd path to education because she started in Saskatchewan. She was a Saskatchewan girl, and she started at the University of Saskatchewan in Saskatoon, following her elder sister who was there. And she took 1 year and she thought, this is not for me. And so she and a girlfriend, off they went all the way to Montreal. And you've got to remember, this was sometime in the 1930s. Off they went to Montreal and went to the Royal Victoria Hospital, and they both studied nursing. And that was the beginning of her nursing career. And she just took to it like a duck to water.
I feel incredibly fortunate to have known Dr. Helen Glass and immensely grateful for her mentorship and friendship. Her visionary leadership and profound contributions to nursing education, practice, and research have left an indelible mark on the nursing profession. As director of the School of Nursing at the University of Manitoba from 1972 to 79, Dr. Glass set the highest standards for nursing education and professionalism in the Bachelor of Nursing program, and played a pivotal role in establishing the graduate nursing program. Her innovative leadership also helped establish national standards for nursing education, leaving a legacy that continues to influence the profession today. Dr. Glass was a passionate champion for nursing research and innovation, and adamant that it would continue to shape nursing education and practice. She was instrumental in founding the Manitoba Nursing Research Institute, which later became the Manitoba Centre for Nursing and Health Research. Her vision to foster a vibrant research community and promote impactful research continues to be realized today, including bringing leading nurse researchers to the university to challenge, inspire, and enrich the learning experience for students, faculty, staff, and the community through the annual Helen Glass Research Symposium. Dr. Glass's legacy continues to shape the future of nursing education, research, and healthcare, and inspire generations of students, nurses, and healthcare leaders.
She was the director of the nursing school at the university, influenced my mom to go to Columbia University in New York City to further her education. So off the two of us went. I was in grade 9 and 10, and she took her bachelor's degree, worked day and night, got it in 2 years, and we came back to Winnipeg.
It is my great pleasure to share my reflections on Dr. Helen Preston Glass, who I knew personally as a nursing pioneer, visionary, mentor, and friend. It was from 1990 to 1993 that I had a good fortune to serve as Dr. Glass's research assistant. I was a Master of Nursing student at the time, and Winnipeg was preparing its bid to host its second Pan America Games. Dr. Glass saw a need and an opportunity to build a world-class residence for the athletes and leverage a much-needed and world-class new nursing building. I was hired to assist her with this project. Nothing was impossible when that dynamo brought her vision, astute timing, hard work, and evidence-based persuasion to the table. She had an ability to gather the right people around the table, to think 3, if not 5 steps ahead, to see win-win solutions, and to be fearless. In 1999, the Helen Glass Center for Nursing on the Fort Garry campus was dedicated in her honor, and I even had the pleasure of piping her into the building. What a great day. And with typical Dr. Glass flair, Her Royal Highness, the Princess Royal, was present during the Pan Am Games that July to open the Princess Royal Walk, that lovely bricked path joining nursing and education, and named in her royal honor. I also learned from Dr. Glass the responsibility that nurses can and must play at the national and international stage in healthcare. She role modeled this view through her leadership as president of the Canadian Nurses Association and in her major influence on the wording and scope of the Canada Health Act. I was so fortunate to know Dr. Glass. She has helped me to look for the bigger picture, to be more strategic, to use evidence to leverage change, to embrace risk-taking, and to support and mentor my students and colleagues. That is a legacy that I'm honored to pay forward.
The satisfaction that she got from her students, they were her passion. She loved inspiring them, and I think she did. From what I hear, she certainly did. But that mattered a lot to her, was the influence that she could have on young students' lives and the influence that she and they could have on the nursing profession. She was probably most honored more than anything else by receiving the Order of Canada. That really meant that really meant the most to her. I think for my mom, anything that her students did, she was extremely proud of. And I think if students can think in that way, is that somebody somewhere will respect what they do, will feel very proud of them, will respect them in the profession. And that particularly mattered to my mother, that the nursing profession was elevated in the acceptance of healthcare. She certainly thought far beyond the hospital setting and the critical care, even though that's extremely important. She really lived by the premise of health for all. And that was extremely important to her. And beyond our borders, not just in our immediate surroundings, but she always thought worldwide. That was what was important. And so if nursing students can elevate themselves to think that way and to think bigger and to always think in terms of the honor that they will garner for the profession, that would be a wonderful legacy for my mother.